Every 33 seconds, someone in the United States dies of cardiovascular disease. And the strange part is, we have more cardiac medications available today than at any other point in human history. More statins, more blood thinners, more interventions than ever before. Here we are anyway. Now, I want to ask you something. If you went to your doctor today and said, I want to actually reverse the plaque that's already built up in my arteries, not slow it down, not manage it, reverse it, what do you think they would tell you? Most would say it can't be done. Or they'd hand you a prescription. Here's what almost nobody in a white coat will tell you. There's a seed, a small, inexpensive seed that's been documented in peer-reviewed research since the early 1990s. A seed that does something statins, one of the most prescribed drug classes on the planet, literally cannot do. It doesn't just slow the accumulation of plaque. It works on the inflammation that builds it in the first place. Today, I'm going to show you exactly what this seed is, exactly how it works at the cellular level, and exactly how to use it. The specific dose, the specific form, and the specific mistake that makes most people get zero results from it. But first, let me tell you what you've been told about arterial plaque, because most of it is incomplete, and some of it is just wrong. Here's the deal with the conversation happening in most doctors' offices right now. Your LDL comes back elevated. The doctor tells you your cholesterol's too high. You get a statin prescription. The number drops on your next blood test. Everyone's satisfied. On the surface, that makes sense. The research connecting high LDL to cardiovascular events is real. I'm not disputing that. What I'm disputing is the part that comes after the prescription, where nobody asks, what about the plaque that's already there? Statins don't reverse arterial plaque. That's not a fringe opinion. A 2015 meta-analysis published in the BMJ confirms statins reduce future cardiovascular events by roughly 25% in high-risk populations. Meaningful number. But the same body of evidence shows statins have no significant effect on regressing plaque that's already formed. So the drug lowers a number on your lab report. The plaque stays exactly where it is. Now here's where it gets interesting. The conventional model treats LDL cholesterol as the villain. High LDL, high risk. Lower the LDL, lower the risk. But what the research has been showing for decades is that the real driver of plaque formation isn't LDL itself. It's oxidized LDL. And those are two very different things. When LDL particles get oxidized, damaged by chronic inflammation and free radical activity, your immune system reads them as foreign. Macrophages rush in to engulf them, get overwhelmed, and die inside the artery wall. Researchers call the result foam cells. That pile up of foam cells is the plaque. So the underlying process is fundamentally inflammatory. It's not just about how much cholesterol is floating around in your blood. A 2012 study in the journal Atherosclerosis found oxidized LDL was a significantly stronger predictor of cardiovascular events than total LDL in patients with stable coronary artery disease. Stronger predictor. That study's 14 years old, sitting in the literature right now. Most people on statins have never had their oxidized LDL measured. Not once. So we've got a drug that lowers one number without touching the inflammatory environment that actually drives the disease, and without touching the structural damage already sitting in the artery wall. That's the gap. And that gap is exactly where the seed goes to work. The seed is flaxseed, Linum usitissima, one of the oldest cultivated plants on earth, used for food and medicine for over 10,000 years. Somehow, also one of the most underused tools in cardiovascular health today. I'll admit, for years I underestimated this one myself. It's not flashy. It doesn't have a dramatic origin story from some remote mountain village. It's just a small brown seed sitting in the baking aisle, completely ignored by everyone walking past it toward the supplement section. What makes it work comes down to three active compounds. First one, lignans. Flaxseed contains more lignans than any other food on the planet. More than sesame seeds, more than broccoli, more than any plant source researchers have measured. Lignans are polyphenolic compounds. What that means in plain language: extremely potent antioxidants that specifically target LDL oxidation in your bloodstream. Remember the foam cells? The macrophages that engulf oxidized LDL and die inside the artery wall? Lignans interrupt that upstream. They disarm the LDL particle before your immune system ever mistakes it for a threat. No false alarm. No foam cells. Less plaque over time. Think of it like this. Your artery wall isn't a passive pipe. It's living tissue with its own immune response built in. Lignans keep that response quiet. Second compound, ALA, alpha-linolenic acid, a plant-based omega-3, and flaxseed is the richest dietary source of it on the planet. Now, ALA isn't identical to the EPA and DHA you'd get from fish oil. Your body converts it, though the conversion rate is modest. But here's what matters for the arteries specifically. ALA acts directly on the inflammatory signaling inside the artery wall. It suppresses a protein called NFKB. Think of NFKB as the master switch for chronic inflammation in the body. Flip it on, and it triggers a cascade of inflammatory messengers that tell immune cells to attack. ALA keeps that switch turned down. Picture the artery wall running a low-grade fever all day, every day, for years. ALA brings the temperature down. And a cooler environment is a much harder place for oxidized LDL to take hold. Third compound, soluble fiber. Specifically a type called mucilage, the gel-forming fiber that makes ground flaxseed slightly sticky once it's wet. This one works earlier, in the digestive tract, before cholesterol ever reaches your bloodstream. The fiber binds to bile acids in the intestine. Bile acids are made from cholesterol. Bind the bile acids, and your body excretes them. Your liver then has to pull more cholesterol out of circulation to make replacement bile acids. Net effect, measurably lower circulating LDL, achieved entirely through a mechanical process in the gut. No drug interaction. No side effect profile to worry about. Check back in right now, because this next part matters more than everything I've said so far. These three compounds aren't working in isolation. They're working as a system. Fiber reduces the cholesterol load entering circulation. ALA cools the inflammatory environment inside the artery wall. Lignans prevent oxidation of whatever LDL does make it there. Gut, bloodstream, artery wall. Three fronts, simultaneously. And there's a fourth piece tying it all together that almost nobody connects to flaxseed. Lignans increase nitric oxide production in your endothelial cells, the cells lining the inside of your arteries. Nitric oxide is your body's natural vasodilator. It relaxes the smooth muscle in the artery wall, widens the vessel, and reduces the mechanical pressure pressing against existing plaque. That pressure matters more than people realize. Most heart attacks aren't a slow, gradual blockage. They're a plaque rupture caused by exactly that kind of chronic pressure. Nitric oxide reduces it. It's your body's own plumbing upgrade, and flaxseed lignans are one of the most effective dietary triggers we've documented for producing it. 4 pathways working at the same time. 1 seed, 30 grams a day. And since we're already talking about what's happening inside that artery wall, it's worth knowing you can actually stack the deck even further. Flaxseed doesn't have to work alone. Pair it with vitamin C. The lignans we just covered need to be converted by your gut bacteria into their active form before your cells can use them. Vitamin C supports that conversion environment, and it also works as a second antioxidant layer protecting LDL from oxidative damage through its own separate pathway. So if your flaxseed is going into a smoothie, throwing in citrus or berries isn't just a flavor choice. It's giving the lignans backup. Pair it with choline-rich foods, too. Choline supports your liver's ability to process and export fat efficiently, and eggs happen to be one of the densest sources available. Flaxseed handles the gut and bloodstream side of this equation. Choline supports the liver side. Together, you're covering more of the metabolic picture than flaxseed alone. Now, here's the comparison I get asked about constantly. What about chia seeds? People assume it's basically the same seed, just a different shape. Here's the actual number. Flaxseed contains roughly 75 times more lignans than chia, gram for gram. Chia has a respectable fiber profile and earns its place in a healthy diet. It's simply built for a different job. Every trial behind the numbers in this video used flaxseed specifically, because that's where the lignin concentration actually lives. So if you want to optimize this, ground flaxseed as your foundation, vitamin C somewhere in the same meal, choline-rich foods elsewhere in your day. None of it replaces the 30 grams of flaxseed itself. It just makes those 30 grams work harder for you. And speaking of what the research actually shows, let's get into the numbers. Let's look at what happens when you actually put this seed to a clinical test. The strongest trial we have is FlaxPad, out of the University of Manitoba, published in 2013. Researchers took patients with peripheral arterial disease, people with documented plaque already reducing blood flow to their legs, and gave half of them 30 grams of milled flaxseed daily for 6 months. The other half got a placebo. 6 months in, the flaxseed group showed a 15% reduction in oxidized LDL. Their carotid intima media thickness, a direct ultrasound measurement of arterial wall buildup, decreased. The wall got physically thinner. Systolic blood pressure dropped by an average of 10 mmHg in patients who started elevated. 10 points off blood pressure. That's in the same range some prescription medications produce. A separate trial out of Iran, published in the Nutrition Journal in 2012, ran the same protocol on 110 patients over 12 weeks. Total LDL dropped nearly 13 milligrams/dl. Key reactive protein, the primary blood marker for systemic inflammation, dropped 14.7%. CRP is one of the strongest independent predictors we have for cardiovascular events. A pharmaceutical trial would be thrilled with that number. Here's the comparison that actually matters. Statin therapy reduces cardiovascular events by roughly 25% in high-risk populations. Real benefit. The cost side includes a 9% increased risk of developing type 2 diabetes, documented muscle degradation in a subset of patients, and no demonstrated effect on existing plaque. The seed, 10 to 15% reduction in LDL. 14 to 15% reduction in inflammatory markers. Measurable thinning of the arterial wall. A meaningful drop in blood pressure. And a side effect profile that, across every published trial, amounts to mild digestive adjustment in week 1 for some people. Cost, under $1 a day. Here's the study that's been sitting in the literature since 1990, and almost nobody mentions it. Herman Adlerkreutz and colleagues published research in The Lancet tracking plasma lignin levels across a Finnish population against cardiovascular mortality. Higher lignin levels in the blood, lower rates of dying from heart disease. That paper is 35 years old. Anyone can pull it up. Of course, nobody talks about it. This doesn't replace every cardiovascular intervention. Patients with advanced disease or specific lipid disorders need individualized medical care. Full stop. But as a daily tool working on the exact processes statins don't touch, the evidence is consistent, reproducible, and now spans 3 decades of independent research. That's what 30 grams a day looks like under a microscope. Now let me tell you exactly how to use it. Here's exactly how to do this, right, step by step. Form first. Buy ground flaxseed, sometimes labeled milled, or buy whole seeds and grind them yourself in a coffee grinder. This part matters more than people expect. The active compounds, the lignins, the ALA, the fiber, are sealed inside a hard outer shell. Whole seeds go in one end and come out the other almost completely intact. You'll absorb next to nothing. Every trial behind the numbers I just gave you used ground flaxseed. That's the form that actually works. If you're buying pre-ground, keep it in the fridge in an airtight container. ALA breaks down with heat and light, and oxidized flaxseed defeats the entire purpose. Refrigerated and sealed, it stays good for months. The dose is 2 tablespoons a day, around 30 grams. That's the number behind every result we just walked through. 1 tablespoon gives you some benefit. 2 is where the clinical data actually lives. Take it in the morning with your first meal. Lignins absorb better with food present, and the fiber creates a satiety effect that carries you through the rest of the day. Stir 2 tablespoons into a smoothie, yogurt, oatmeal, or a salad. Mild flavor, slightly nutty, genuinely easy to get used to. One thing to skip, high heat cooking. Baking it at high temperatures or frying degrades the ALA. Add it after cooking or keep it under 300 degrees. Drink at least 8 ounces of water with it. The fiber in flaxseed is hydrophilic. It pulls in water and forms a gel. And that's the exact process that binds bile acids in your intestine. Skip the water, and you're not just losing efficiency, you're also asking for digestive discomfort. 8 ounces minimum. One real caution. If you're on warfarin or any anticoagulant, talk to your doctor before adding this at full dose. Flaxseed has a mild blood thinning effect through its omega-3 content, and stacking it with anticoagulant therapy without monitoring can shift your INR. That's not a reason to avoid it. It's a reason to bring your doctor into the loop if it applies to you. For everyone else, 2 tablespoons of ground flaxseed every morning with food for 90 days. Most people notice better digestion within the first 30. At 90, ask your doctor to recheck 4 numbers: LDL, HDL, triglycerides, and CRP. Those 4 will tell you exactly what's happening inside your arteries. Try it for 90 days. Prove it to yourself. Now, here's the part most people skip: the mistakes. I get messages constantly from people who say flaxseed didn't work for them. And almost every single time, it's one of 4 things. The first one is the seed itself. Pre-ground flaxseed sitting on a regular grocery shelf under fluorescent lighting for who knows how long before it got to you. ALA degrades with heat and light. If that bag has already spent weeks in a warehouse and on a store shelf, a meaningful chunk of the active compound is gone before it ever reaches your kitchen. Buy from somewhere with decent turnover, check for a recent packaging date, and refrigerate the moment you get it home. The second one catches a lot of people, and it's an honest mistake. Taking flaxseed oil capsules and assuming that's the same thing as ground flaxseed. It is not, and the difference matters more than you'd think. Flaxseed oil gives you the ALA. That's it. The lignins live in the seed's outer hull, not the oil, so you lose those almost entirely. You lose the soluble fiber completely too, which means the whole bile acid binding process is gone. The oil is doing one of the 4 jobs we talked about. The whole ground seed is doing all 4. Third mistake: toasting the seeds, thinking it improves something. I get the instinct. Toasting deepens flavor in most nuts and seeds, but flaxseed's ALA is specifically heat sensitive, so toasting isn't unlocking anything. It's quietly destroying the part you're after. If you want a different flavor, fine. Just know what you're trading away for it. Fourth, and this one applies even if you're nowhere near a blood thinner, taking flaxseed at the exact same time as other medications, especially thyroid medication. That fiber-binding bile acids in your gut doesn't selectively bind only cholesterol. It can grab onto certain oral medications too if they're in your system at the same time. The fix is simple. Separate flaxseed from other medications by 2 to 3 hours. Take your medication, wait, then have your flaxseed with a later meal. Stale seeds, the wrong form, unnecessary heat, and bad timing. Avoid those 4 and you're running the exact protocol the clinical trials ran. I want to give you a realistic picture of what's actually happening inside your body once you start this. Not an overnight fix. Here's the real timeline. First, 48 hours, the fiber mechanism is already active. The mucilage starts binding bile acids in your intestine on day 1. You probably won't feel anything dramatic. Some people notice mild digestive adjustment as the gut adapts, which is normal and usually settles within the first week. End of week 1, your liver has started pulling more cholesterol out of circulation to replace the bile acids you're excreting. Completely silent. No symptom you'd notice, just a metabolic adjustment running in the background. Week 2 to 3, lignins have built up to a meaningful level in your system, and their effect on LDL oxidation becomes biologically significant. Fewer LDL particles getting oxidized means fewer triggers for that immune cascade, the macrophages, the foam cells. Week 4 to 6, this is typically the first point where blood markers start moving. CRP, your inflammation marker, often begins trending down. Get blood work at week 4, and you might catch early movement, though usually not the full picture yet. Week 8 to 12, this is where the Flax pad and Iranian trial numbers become visible. The 15% drop in oxidized LDL, the measurable thinning of the arterial wall, the blood pressure improvement. 3 months of all 4 mechanisms compounding on top of each other, and that's when it shows up clearly on a lab panel. So don't check your blood work at 2 weeks and assume nothing's happening. Something is happening daily, at the cellular level. It just takes the full 90 days for that work to show up on paper your doctor can read. That's the entire reason the protocol is built around 90 days. A few groups of people should approach this a little differently. Quick rundown, then we'll wrap up. If you're pregnant or breastfeeding, the research on flaxseed's phytoestrogen content during this period is genuinely mixed. Some studies show no concerning effect at normal amounts, others raise questions that haven't been fully settled. Talk to your OB or midwife before adding the full 30-gram dose. If you have diverticulitis or any condition involving intestinal narrowing, start much lower than 2 tablespoons, or skip it for now. The same fiber that's binding bile acids can be too aggressive for a digestive tract that's already compromised structurally. Your gastroenterologist will know your specific situation. If you're on thyroid medication, you already heard this, but it's worth repeating. Separate flaxseed from your thyroid medication by at least 3 to 4 hours. The fiber can reduce absorption of the medication if they're taken too close together. And I'll be straight with you about one more thing, because pretending the research doesn't exist would be doing you a disservice. There's an ongoing scientific conversation about lignins and hormone-sensitive breast cancer. Some research suggests lignins may actually be protective given how they interact with estrogen receptors. Other researchers have raised theoretical concerns. Right now, the evidence leans toward flaxseed being safe, and in some studies beneficial for most people, including many breast cancer survivors. But if you have a personal or strong family history of hormone-sensitive breast cancer, have that specific conversation with your oncologist. That's not me being cautious for the sake of it. That's just respecting that your history belongs in that decision, not a video. For almost everyone watching this, none of that applies, and the protocol is exactly as straightforward as I laid out. For the few it does apply to, one conversation with your doctor settles it. All right, let's bring this home. We opened this video with someone dying of cardiovascular disease every 33 seconds in a country with more cardiac drugs on the market than at any point in history. That gap isn't a drug shortage. It's the inflammatory, oxidative environment driving plaque formation in the first place, and the near total silence around dietary tools that go straight at it. Flaxseed goes straight at it. 3 decades of research, multiple independent trials, 4 processes running at once on the gut, the bloodstream, the artery wall, and the lining of the vessels themselves. 30 grams a day. Under $1. If you're already on cardiovascular medication, keep taking it and talk to your doctor about adding this alongside it. These aren't competing strategies. If you're managing your heart health through diet and lifestyle, this belongs in the routine starting today. Come back in 90 days and tell me in the comments what your numbers did. Your LDL, your CRP, your blood pressure. Post them. I read every single one, and those threads end up being some of the most useful real-world data this whole community generates. Now, flaxseed works on the environment around the plaque. There's another compound that works specifically on the endothelial lining itself, the tissue that determines how elastic and responsive your arteries actually are, and almost nobody's heard it discussed this way. For that, watch this video right here. I am Andrew Collins, and I will see you in the